Hello viewers, thank you so much for supporting our Malligai Dental Academy's YouTube channel. Today we are going to talk to Dr. Balamurali. He's a very young pass out dentist and he has come to us to complete his internship, special internship program, which comprises of lot many courses in which he has to place mandatorily 10 implants on patients, and he has to do 30 root canal cases, and he has to do complete denture, he has to do impactions, he has to do extractions, he has to do a lot of crowns and bridges, everything you need to run a successful dental clinic, plus documentation, dental photography, videography for YouTube channels. And he also has to do mandatory management study through bootcamp. He has to run the clinic, administration and management also. So he has completed almost a month, doctor?
Yeah, 3 weeks.
Almost 3 weeks he has completed ever since he has reported to Malligai Dental Hospital. Today he has successfully completed his implant training. We are going to ask him the details now and what kind of transformation he has gone through. First of all, I would like to thank you for trusting me.
Thank you, sir.
Because you came to me. One fine day, suddenly I saw he was sitting in front of me. He didn't say anything. He inquired. He made a one call. I've written in my inquiry note. Next day he came, paid off all the fees, and he said, "Sir, you tell me when I have to come, I will come." He was a man of few words. He speaks less. So always I believe those who speak less will live longer, because their quota will be still there. And my quota, I speak a lot. So I don't know, by God's grace, we'll all live longer and stronger. Let's take it this way. How do you feel, Balamurali, after this 3 weeks of clinical training? We will take further videos also. This is just a casual interview. Please tell me, how do you feel before? How do you feel now? How you are feeling?
Hi, sir.
Hi.
Before I came here, I thought of preparing for NEET PG.
Okay.
So I studied for.
When did you pass out?
2020.
2020 you passed out. From which college?
From Vinayaga Missions.
Vinayaga Mission, Salem. Okay. Doc, where are you from? Which native you belong to?
I'm from Kongayam, Tirupur district.
Okay. What is your dad doing?
My dad is an accountant in an oil industry.
Okay. In an oil factory, he is an accountant. Yeah. Fine. Tell me, thinking of your career, maybe after 2020, due to this COVID and all this, I just want to get your real-time thought process feedback. What was there in your mind about your career?
So while I started doing my internship, COVID started. So I can't do much cases in the college. And I don't have an exposure how the real clinic works. And after the COVID also, the clinic, due to the COVID, many clinics were closed.
Okay.
So I thought of doing PG, preparing for NEET PG.
Okay.
I started preparing for an ET, but I didn't get what I wanted. So I thought of doing the next year. But in the meantime,
so your plan to join PG is slightly shifted to the next year plan. Yes. So in the meantime, you don't want to waste your time and you want to come here. Very excellent planning, because suppose you join a PG, suppose you become an orthodontist, sometimes you may not be thorough in endo forever. I'm still getting calls from a lot of specialists who are surgeons and prosthodontists. They say, I don't know this basic thing also. Because we think specialist means knows everything. Specialists are specialists in only that subject. That's what I feel. Only a general practitioner like me, we get involved in many things, so we come to know. As far as specialist knowledge is concerned, especially nowadays, I'm not talking about the PGs of those days. PGs of those days, they did from government college, every OP, everything they saw. And PGs of this year, this present generation, especially this after 2020s, it's little tough. Exposure is less and tougher situations are waiting for them. Doc, you tell me, what was your mindset like? What were you thinking in your mind?
When I called you, I don't have a fixed plan.
Okay.
I thought of doing only rotary. So I called, I asked about only the rotary.
So you called me for rotary, so I motivated you to go for internship. Do you think that choice of shifting from rotary to an internship is good?
At the time I thought, I don't know what to do. But after joining internship, I'm really glad I joined the internship.
You were really glad?
Yes.
So tell me how you became glad.
So, if I join rotary, I can focus on only rotary. But if I join internship, I can see all the OP cases Now I assisted you in some cases, so I get the idea of what I will be doing here.
Okay, fine. So tell me this: in this last 3 weeks, what and all you have gone through? What and all you have gone through?
For the first few days, I observed what and all that, and I talked with the staffs here. I get to know, and then I started seeing what are the duty doctors are doing, and I started seeing OP, and then I practiced some rotary in dummy works.
How many RCTs you completed?
Now I started one RCT.
One
started
RCT
doing
you completed.
that,
Okay.
and then I shifted to the implant courses and started doing cases.
So since this course was already planned and you joined, so we clubbed you in this course. It's like because this kind of opportunity you won't get it again.
Yes.
So do you think is it true?
Yes.
Please tell the viewers how many cases you have completed in implants.
I completed in a week. I completed 7 cases.
So 7 cases he has completed, and yet I have to give him a guided case and a few other cases like sinus lifts and all that. So he has completed 7 implant cases, which I can vouch that most of the PGs themselves would not have done in their agent service.
Yes.
How proud you feel about it?
I'm really glad I came here, but now I can meet some new people who are more experienced than me, more senior than me, and they also guide me to what to do.
So when you look at your seniors, what do you feel? Namale paravalle.
No, not like that.
Okay.
I'm really glad I'm meeting these people.
So this place is, I want my life to be a happening life. I want my clinic to be a happening clinic. I want my academy to be a happening academy. Like some activity. Even in COVID, I was not idle. I took a nice course for my dental assistants training program. I'm so glad you came and did 7 implants. I'm telling you, you are an awesome material. First of all, give you a hand, man. I'm really blessing you. Many more to come. Your perspectives will change because since he's doing this course, when he goes for his NEET selection, he can take the right PG because he knows his strength where he in RCT, in ortho, where he's also going to learn basic orthodontics because he needs the knowledge to diagnose and things like that. I can tell he will be one of the best informed candidate to select a good PG seat, right or wrong?
Yes, sir.
Because most of the students, they study, they simply go select which government college, which PG, because they look at somebody and they said, but he will know what he is actually made of, whether he is made for a surgery, whether he is made for a RCT endodontic guy, whether he is going to be an orthodontist, everything he is going to decide because he is going through this internship program with a lot of exposure. Am I right?
Yes, sir.
This is my understanding about you.
Yes, sir, you are right.
Cool, right?
Yes.
I'm so glad. I feel sometimes you are too shy to talk. Yes. And I just want to ask you, how important for a youngster, anybody, maybe in dentistry, talking, how important it is after seeing my clinic and our approach?
To be frank, you are the complete opposite of me.
Yeah, we are opposite. I'm too talkative. You are talking less. Good.
Yes. But after seeing you, I have to talk to the patients.
Why?
Obviously.
Why?
Because I have to explain them what I have to do, what they have to do, and you have to convince.
This is what is important. Even I am I was an introvert. I can say, I was even more quieter than him, even more shy. I trained myself to become like this. Because I know if I'm too shy, people think I'm too timid. If I am too quiet, people think I'm not good enough. Okay, especially one mentor taught me this. Okay, this is a secret I want to share to all the doctors over here. Okay, they say energy. They say what? Energy. The higher energy always wins. So when a patient comes to you and his energy is higher and your energy is lower, he will always win. He will always go back. Try to take the command of that situation by being higher energetic. Higher energy, I always teach, comes from asking questions, saying something like thank you, please, and asking provocative questions like you have to make them talk than you talk. Okay. So in a clinical scenario, most of my assistants are almost, they can't speak. They don't open their mouth properly. So what happens is people think they are scared to talk itself, how they are going to do dentistry. They think, so energy your energy should be so bubbly, they should feel good about you first of all. Oh, this guy is so bubbly and he's so good. At least I know definitely he will do a good job for me. This is called explanatory principle, which is like they explain themselves like that. Okay, like in a 5-star hotel you go, the reception area is good. So we think everything is good. Everything is good. So likewise in your clinic, if your reception is good, they will know everything is good. I teach this in boot camp. So I want you to next I'm going to train him in communication skills. He has to talk, he has to present a case, and complete personality change will happen to him once he goes back. And I will tell you, in his batch, he will be the best. In his 2020 college batch, he will be the best. I can bet it because I am going to train him in such a way that he will know what is the right thing to do. Okay, doc. Tell me in coming back to our surgical implantology discussion, how was your exposure to various things? Do you able to capture it? Do you able to understand it?
Yes, you gave me access to some online courses. So I read all the courses and saw the videos. And I get to know the theory part separately in my own time, in my own phase. And then I will start doing cases and I get
so that is helping you.
Yes, sir.
Online courses good?
Yes, sir. I can
so all
understand.
the knowledge, you gained all the knowledge.
Yes, sir. I know what to do. What next will come, I know through the videos.
Lovely, man. I'm so impressed by your because this online thing is giving me goosebumps now.
Yeah.
Okay, because I think I'll add up more content in that. I'm going to do more content like people were asking me for CBCT and all that. Let's do it again. So, buddy, I just want to ask you, in this case exposure, did you find any difficulties somewhere? Sir, this was difficult for me, but you're pushing me in this. Like, did you feel anywhere like that?
So, we know the procedure we can do once we start an implant, we can do up. But if any failure comes, how to manage, how to go back a step and do that, I'm learning that.
Okay, so you're also learning how to plan for emergencies.
Yes, and emergencies.
Okay. During this surgery, anywhere you felt very bad, like very fearful or anything like that, to go and proceed with implants?
Not fearful.
Oh shit! Why you came here and got stuck here?
No, not like that. Because you are here, you can guide me if anything goes wrong.
Okay, you have 3 more implants to be placed.
Yes, sir.
And I will not come at all. Okay, don't place implant anywhere. Okay, you have to place in the right socket. Don't worry. See, can I tell you something? Like, even me, I'm very scared to run the clinic every day. Every day, I'm very scared because I'm also like you only. Once upon a time, suddenly I realized I've grown up, I've become old. Now I have many clinics, 1 or 2 clinics I have here. Many chairs, many patients, many staff. You know, it's overwhelming for me. I'm also crying every day. At times I cry. I feel bad, I cry all alone. In my prayer, I can say I'm a very spiritual person. So I pray to God. I pour out my heart. Sometimes I feel better when I cry. I say, God, it's not going to be happening anymore. I'm going to give up. I'm going to quit. I'm going to give up few things, few dreams, few things I'm going to give up. It's too tiring for me. Why people are putting so much trust on me? Why doctors are coming to me? Why patients are coming to me? Everyone comes and they trust me so much. Lord, I am nobody. People are trusting me so much. I cannot express my feeling. I feel scared too. ரொம்ப கஷ்டமா இருக்கும். Sometimes நடத்துறது it's so difficult. All the time you think, sometimes the brain doesn't sleep at all. You get so much energy, especially during this training. Yesterday, last night after 2 o'clock, I'm not able to sleep. I slept till 1 o'clock. Again, I woke up and I'm feeling very fresh. Brain is so active. Even one of my participants telling, my wife says, your wife, no, she says, you don't sleep, your brain don't sleep. People who have got a lot of thought process, their brain is so active. Why? Because so much of commitments. I want this subject to make you out of sleep.
Okay.
Tell me this, doctor, what do you want to tell the youngsters who are watching this in one line? If you want to advise something to the people who are watching, especially 2020 batch or 2019 young batch, last 3-4 batches. அவங்கள என்ன நினைச்சிட்டு இருக்காங்க dentistry பத்தி? இப்போ அவங்கள எனக்கு தெரியணும்ல. I want to know what is there in the mind of youngsters. What do you think? How do they think they make money for their living?
So what I thought is, if after finishing, I have to do either PG or go to a clinic and started doing clinic cases. That's it. I thought. But after coming here, I thought there is a separate, many courses are there. You can specialize in something.
Even if you don't get a PG
Yes.
in your dream subject,
Yes, sir.
you can take anything it comes to you, or you don't take also, doesn't matter.
And then
You can keep updating your knowledge. And
yes, sir.
regarding practice management, you are a young kid in dentistry. Tell me how difficult it is to run a clinic. From your perspective, what do you look at me? This guy is suffering or this guy is working hard. How do you feel?
So much hard work to maintain and organize everything.
Organize everything, right? Yeah. Tell me one moment, one aha moment. Aha, what is this? One aha moment in the last 3 weeks. You assisted me a lot of cases.
Yes, sir.
Impaction you assisted. Extractions you have assisted. Implants you assisted. Even before the course, your course begins. Every day you are with me.
Yes, sir.
Is it good?
Yes, sir, sure.
So what did you learn in that?
We had to think spontaneously while doing cases.
While doing cases, anything goes wrong, don't panic.
Yes.
Just quickly improvise. Can you tell any scenario to the viewers? This happened, so sir did like this. Anything you can remember?
While doing an impaction case, we thought there is a single tooth in a mesoangular impaction. But after opening the flap, there is another tooth.
So basically, there was a mesoangular tooth and there was a fully bony impacted 7 and 8 was there. So we removed the 8 and we were able to access to the 7, which is almost on the nerve actually. So under the root CJ, below the CJ of the 6, it was there. So luckily, even I'm not a oral surgeon, but I'm also very interested to do that. Balamurli, can I tell you, the success of that case goes to you also. Credit, because when you teach, you perform well. When you do, you won't perform. When you teach, mindset, you are a teacher, you have to do well, you have to be confident in front of your student also. That helped me, actually indirectly helped me. I really acknowledge this success to you also, boss, because you are there and I don't want to get scared. Even I get scared when I do a surgery, because you have to motivate yourself, you have to do a lot of self-talking to yourself. Chalo, what to do? Talk to your mind. You literally have to be very eccentric in your thoughts. You have to be very, very, very focused, very, very ambitious in your cases also. When you perform a surgery, anything can go wrong. Your instrument can drop. You can put anything in the mouth of the patient. And, bleeding can happen and things like that. So overall, your internship is going well.
Yes, sir.
And anything you want to tell about your colleagues, how you enjoyed your course with Dr. Ken and Dr. Veena and Dr. Gayatri and other friends?
I have been grouped with 4 people, and all of them are my seniors. So each day I
Can you
learn
tell one
thing
good thing in each of them, in each of your friends?
I can get all the perspectives, different perspectives.
Like?
Yeah,
it's okay, you can tell. Start with Ken, who is handling your camera. Yeah.
Dr. Kent, I'm really impressed.
Ken's business is to impress people.
Yes. And then I met Dr. Veena.
Okay.
She's so down to earth.
Yeah.
And helped me with a lot of doubts.
So whatever doubts you had, she asked.
Yes.
She bombarded me with a lot of doubts.
Yes.
That's what you meant to say. Okay. Then what about Dr. Gayatri?
Dr. Gayatri, she's also a very nice person, and she explains what to do next and give me a guide to what
She was looking very confident for me.
She gave me a lot of confidence.
In your batch, I can tell you, I'm very, very scared before every batch. How to put all these people together. Everyone will be in different wavelength and everyone will be in different mindset. And everyone is from different places together also. So first of all, I usually pray, God, everyone should work together as a team, and timing, everything. We have to know how much time you will take, how much time he will take. So that first full day will be my assessment only about each and every one of you, how much knowledge each and everyone have, body language, everything I assess. And then I change the plan also. So this case is not suitable for give this case. There are many things. I'm very glad. Even I think my army training helped me to do all this running around. You know, I like doing all this. I used to do with a lot of energy when I was in the army, organizing things, yeah, events, and so many things. I'm so glad that four of you have got your life transformed in this week. And I thank Jesus, my favorite God, for all this, because I'm literally praying for all of you. And my team members also, I'm very thankful, because without them, this would not have happened. And I'm so grateful to each and every one of you that these kind of courses are life transforming. And one thing, whether it is transforming you or me, it is transforming the life of patients. So many patients are so wonderfully getting their life transformed with our implants and teeth fixing and all that. So we'll keep putting your, after every course, your updates will come. Okay, yes. Thank you viewers. If you have not subscribed to the channel, please subscribe to the channel. Hope this conversation of us have motivated you, each and every one of you. And please put your valuable comments about our discussion and everything. Thank you so much, and God bless you. Have a great life ahead in your career. Thank you. Thank you, Dr. Bala.
Thank you, sir.